Thank you for listening to this presentation, which is an annual update for all of the staff at Wye Valley on what we achieved last year in terms of improving care for patients, investing in our future and improving the experience of our staff as well, and our plans and priorities and things that we're going to focus on in this coming year. This is the executive team for the Trust, and we share a Chief Executive and Medical Director with South Warwickshire Foundation Trust. And the day-to-day executive leadership is provided by myself and the rest of the team, including David Mowbray, the Operational Medical Director, who's been the newest member of the team. So here are some highlights of our achievements from last year for patients. So we saw an awful lot of patients through our organisation, both in A&E, as admitted as electives and emergencies. We deliver care to 660 patients a day through our community services, and thousands of patients have their tests and diagnostics done with us. There's a whole range of ways in which we've improved care for patients, but some of the highlights are we met all of the main cancer targets for patients, which meant that they were getting timely care. That's something which isn't being achieved right across the NHS, and something we can be really proud of. And although we didn't meet the A&E target of 95% of patients being seen within 4 hours, we did improve the time of the attendance to being seen by a clinician from an hour and a half down to about an hour, and that's a really big improvement for patient safety. We reduced the number of harmful falls across the Trust by 21%, a really big improvement. And the number of formal complaints that we have has fallen by 1/3 on the previous year. We've really improved our financial stability this year as well. We've reduced our financial deficit by £11 million, and everybody's worked really hard to achieve that. And part of that has been a reduction of agency spend by over £1 million. What that means is that our regulators are confident in us and are starting to invest in our future so that we can invest in our services. We've secured a £15 million investment into replacing our radiology equipment over the next few years. And across Herefordshire, for both social care and our community services, we're investing in a home first service so that more patients can be cared for at home rather than in a bedded facility. 7-day service, we've invested in 7-day pharmacy and 7-day consultant physicians so that we've got a standard of service on a Saturday and Sunday the same as we've got during the week. And obviously the last one is the £15 million for our hutted wards replacement, which we've been waiting for so long. We're also investing in our staff. We've done a lot of training on QSA training so that we're helping staff to improve their services by having the skills that they need to do that. And we've implemented the Data Action module to make sure that we're learning all the time from things that happen. We did a lot of staff engagement sessions about a year ago, and staff told us about a number of things that they felt would make working here better. One was around flexible working, so that policy has been revisited and relaunched. They also said that leadership behaviours could be more consistent in the organisation, so we launched our leadership charter to describe the behaviours that we expect from all of our leaders and those in management responsibility. And we're also making sure that we are meeting our targets in mandatory training and staff appraisal, so everybody can make sure that they've got the skills that they need to do their job. So much more for us to do together this year. This is our integrated care strategy, which we launched a couple of months ago, and Glenn Burley has made a video of this if you'd like to find out more about it. But what it's about is saying that we're trying to keep patients right in the centre of everything that we do and helping patients to help themselves, providing much more care at home where that's possible. And so the acute hospital is a place where patients come only when they really need the care and support of the acute hospital. And very much working with our partners in social care and in primary care and voluntary sector to deliver that care. You'll also see this as a poster around the organisation, which is our focus and priorities for this year. We have 3 main quality priorities for the year. The first is around reducing avoidable deaths, and very much those 7-day services are part of that strategy. The second one is around reducing variation in practice, particularly around care bundles, looking at the last 1,000 days of patients' lives, so looking at things like PJ paralysis, and very much around effective discharge planning. The third quality priority is around enhancing the care for our vulnerable patients, so Admiral nurses for patients with dementia, and making sure that dementia and learning disabilities patients have a passport, so wherever they are in the system, all of the staff and all of the agencies understand what their needs are. We want you to keep telling us how we can improve things for you and for your patients. So I run a regular open door session where I welcome any staff to come and meet with me with any issues that you have. Rumour mill is there and walk-arounds from the senior team. Email any of the directors and definitely invite us to your place of work so we can come and see what you do in your place of work. We run Let's Talk sessions, but also we've invited you recently to comment on how communications are going in the organisation and are there things that we can do better. Christabel Hargraves is our Freedom to Speak Up guardian and is a place of last resort if you feel that you're not getting listened to. So lastly, thank you. Certainly I saw over the course of the winter and some of the winter snow that we had, what we can achieve together as a team where we all really worked very hard together to make sure that we kept patients safe. We have achieved an awful lot in the last year. Thank you for all of your efforts, and I know that we will continue to achieve more.